You've taken Cleerly from pre-revenue and under 34 people to a 300 plus company, doubling sales each year whilst you've been there and scaling at a rapid pace. What's been the hardest thing that you've had to protect each year during that phase?
Yeah, I mean, the hardest thing for us to protect is just our focus. The focus on why we started this company ultimately to begin with. When you look at the technology of Clearly, it's so amazing that you can take it in a number of different directions. It's a matter of sticking to our mission. The original mission, and still the mission today, is to create a world without heart attacks. And that's what we're doing. I often refer to Clearly as the mammogram of the heart because we're catching heart disease as early as possible so that you can effectively treat it to prevent the downstream effects, the negative effects from a heart attack from ever happening in the first place.
Interesting. And as the company's grown, what do you think the biggest difficulties have been, year on year as it's scaled?
Yeah, I mean, the difficulty is always like with any medical technology, I would say it's changing physician habits. It's the inertia. Starting out my career, I started out in the world of cardiac surgery, moved into digital health, now back into cardiology because I wanted to be upstream of the problem as opposed to on the downstream of the problem. So rather than working with technology that was going to treat the negative effects of heart disease, how could I get the patient sooner? And still, the most difficult part is that physicians don't change habits quickly, even with cutting edge technologies or even with all the clinical data that you have in the world. It's a matter of demonstrating to them again and again and again why they should utilize this technology. Why does it improve patient outcomes? How does it make their workflow and efficiency that much easier? And then also the positive ROI, on the technology itself. Like ultimately, how does a hospital or how does a practice actually utilize Clearly profitably for their business while treating patients?
Perfect. And we'll come back to that. We'll talk more about Clearly later on. But what I'd actually like to do right now is talk a little bit about your background and how you got into medical devices. What was the origin story for you? How did you end up here?
Yeah, for me, I mean, I started out within medical device back in 2005. Prior to that, I had been in the pharmaceutical world for 9 years. And then prior to that, my background was actually in corporate finance. For me, I wanted to move into healthcare because I wanted to do something that had a direct impact on patient lives. There's nothing like seeing how your technology or whether it's a device or whether it's a medication, how that positively impacts somebody's life. So, years ago, my dad died of heart disease. My mom's had multiple heart attacks. So I've always been drawn to cardiology, number one. I joined Guidant in 2005 as a cardiac surgery rep. So in the OR, working with physician assistants with our technologies and doing bypass surgery and did that for 9 years. Actually moved from a rep to a director to a VP of sales at getting to where I had overseen all of their national U.S. business for that period of time, about 200 people, about 200 million in sales, and then decided that I wanted to jump into the startup space. Got a little bit tired of the bureaucracy of a big company. And so I jumped to Livongo in 2017 to build out their health system team from scratch. And we did that for 3 years. Built that up to about 40 million in ARR over the course of that 3 years. We went public. We got acquired by Teladoc. I ran their third-party administrator team for a year, and then decided I wanted to do all over again, and then jumped to Cleerly. Joined Cleerly in 2021 when we were pre-revenue. We were about 30 employees at the time, and like you said, over the course of the last 4.5 years, we've been fortunate to double sales every year, and we've grown now to about 350 people within the organization.
It's incredible. And, it's something that I think I'm seeing more common now. You mentioned, obviously, you've had family history of cardiac failure and cardiac issues. Do you think that's one of the biggest drivers for innovators in the space these days?
No doubt. I mean, everyone knows, even though I know it's a statistic that's thrown around a lot, like everyone knows, like heart disease is the number one killer. But why is it still killing so many people every year? And this is why I utilize the comparison to a mammogram. So whether it's someone's wife or daughter or sister, Like, why do they go get a mammogram done? Well, they get a mammogram done because they want to find out if they have breast cancer or not. And God forbid if they do, they want to catch it as early as possible so that they can treat it. So, in other words, like they don't wait until they start having symptoms or until they start coughing up blood, to go get a mammogram. And the thing about it is, with heart disease now, we're still diagnosing it on the back end. Like we're still waiting for people to have chest pain before actually diagnosing heart disease itself. And the only way to truly diagnose heart disease is to image the heart. You can take markers like cholesterol and blood pressure, and all of those things are important, but unless you're actually imaging the heart and seeing the vessels of the heart and seeing if there's plaque inside the vessels, you don't know if someone has heart disease or not. And so, yeah, you're exactly right. Is that we talk about it a lot, but we just not been going about it the right way ultimately until this technology.
And that makes me think. Well, that also. Well, sorry, I'll rephrase that. That almost makes me understand now why you switched into a different area. So, if you look at your earlier career, you spent a lot of time commercializing cardiac surgery and interventional devices. Now you're running a business that's essentially intervening before that even has to happen. So what did you see in those earlier days in cardiac surgery that made you want to switch worlds and want to intervene quicker?
Yeah, I mean, it was I was seeing younger and younger patients in the OR. I can remember I was in the OR one time with a physician, and this patient that they're wheeling in to have a triple bypass done was a 38-year-old professional triathlete. And I'm thinking to myself, like, all right, I'm on the wrong end of this. Like, I've got to get upstream from this disease because, like, how is it that somebody that's 38 years old, that's a professional triathlete, how is this person having a triple bypass done? And that's really where the light bulb went off for me of like we're going about this the right way. Like we have got to get to this way earlier before the negative downstream effects that had happened. And then, like I shared earlier, I mean, within my own life and within my own family, seeing multiple friends, have heart attacks, and it's like, man, why is this happening? And especially when you see people that seemingly look like they're in great health on the outside, going back to that athlete. So yeah, that's where the light bulb went off for me. And then luck would have it that I had come across Cleerly and their technology and thought like, man, this is exactly what I've been looking for.
And so if I look to your background, up until Livongo, really, that was when it sort of switched from a traditional medtech role into something else, right? What do you think the space that Livongo was operating in taught you that the device world hadn't?
Yeah, for Livongo, I mean, it was a fantastic organization. So a couple of things that I come away with at Livongo that I think were near and dear to me. Number one, like aside from Cleerly, it was the most mission-driven organization that I had ever been a part of. So with Livongo, we were focusing on helping people with chronic conditions, namely diabetes, which also contributes to heart disease. But within those 900 employees at Livongo, a third of them were living with diabetes. So they were living and breathing this, every day and seeing how having diabetes negatively impacted their life, how they had to manage their life, what they ate, how they slept, all of these things to take better care of themselves to manage that diabetes. So on the one hand, it was the mission of the organization. The second piece that I would say that was very impactful to me was it was the first truly subscription based model that I had worked in, a true SaaS based model. And I took that knowledge and I brought that over to Cleerly. When I first started at Cleerly, it was very much a per click model. The physician does a test, we charge them for a test. And I changed that model to where I made it a subscription based model for a couple of reasons. Like number one, um, it fit better within the workflow of our clients themselves. If every time that they did a CCTA, they automatically ran a Cleerly analysis, it made the efficiency of their workflow a lot better. Also, when we looked at the pricing model that we have in place with Cleerly, the volume-based discounting that we do fits very well within that subscription-based model. And then also for consistency of revenue, consistency of earnings for our investors, for our board, for projections. That subscription-based model also makes it something that is very appropriate to our business. So it's a win-win-win for Cleerly and for the patients and for the providers.
And do you think we're going to start to see a pivot into that space? I'm seeing more and more companies, almost testing the waters with it and looking at different areas and being creative in that fashion. Do you think we're at the tip of the iceberg where this is going to become a lot more common now?
In terms of plaque analysis itself or the subscription piece?
Sorry, the subscription base.
Yeah, I do. I mean, one of the things that we've talked about for years, within healthcare is value-based care, right? And like in America, we very much have a sick-based care system, and oftentimes it's the incentives aren't necessarily aligned, and what I mean by that is that oftentimes when people are getting more tests, whether it's the hospital or whether it's the physician or whether it's the insurer, the financial incentives aren't always aligned, and ideally it would be, hey, look, the better care that you take care of someone, the more money that you're going to save. And we definitely have the ability to do that with Cleerly, because here's another statistic: 70% of the people that wind up in the cath lab for a heart cath end up being normal. Like, they may have chest pain, they may have some plaque, but like 70 studies show that 70% of those people could have been treated with medications as opposed to going in the cath lab. So again, if we can utilize Cleerly to diagnose those patients and then determine who needs to go to the cath lab and who doesn't need to go to the cath lab, we have the ability to generate a significant amount of savings for the healthcare system, but also just a better quality of life for that patient. If you don't need to go into the cath lab and you can be treated with medication, why wouldn't you do that? So it's another piece of the puzzle that it's a win-win for both the patient, the provider, and for Cleerly.
And 70% is eye-watering, right? And I could be wrong here. I don't know the cost of this, so maybe you can elaborate. Just on average, how much would that cost per patient of the 70% that didn't need to be in a cath lab?
Yeah, at minimum, you're looking at $15,000 to $20,000 per patient that don't need to go to the cath lab, that are then going into the cath lab, because when you're paying like procedure fees, time in the cath lab, all of those things, as we know, it quickly adds up.
And so we've got a little bit of a a little bit ahead now, and I kind of actually want to steer this back a bit, because the science behind what created Cleerly is truly a fascinating story, right? It wasn't always a startup. I appreciate it probably started, 2 decades before with Dr. Min's research at the Dalio Institute. So how does it feel to commercialize someone else's work in this space?
I mean, it's fantastic. I mean, I always say, like, Cleerly, this technology, I am 100% convinced, will be the standard of care. Much like whether it's women in your family that go in for a mammogram, or whether it's individuals that need to go and get a colonoscopy done. Like, this is the way that you will diagnose heart disease. Like, and I whether it's members of my family or friends or anybody that'll listen, like, honestly, like anybody that's 40 and above, I say, like, you got to go get this done. Insurance may or may not cover it depending upon what your symptoms are, but even if you're paying out of pocket, like, you have to get this done. The statistic I use all the time is 50% of the people that have a heart attack have no prior symptoms whatsoever. So even you may be thinking that you're taking great care of yourself, you're not smoking, you're exercising, you're eating right, and yet, you're dropping dead of a heart attack, or you're having a heart attack. And so this is absolutely the way that heart disease will be diagnosed. So, I feel very, very fortunate that that Jim Min developed this technology, and that he put the team together to be able to commercialize this technology. And we are just scratching the surface, as an organization. As you'd mentioned, we've doubled sales every year for the last 5 years that I've been here, and that trajectory will absolutely continue, because there are so many patients out there, both in the US and worldwide, that can benefit from this technology.
Absolutely, and I've been fortunate enough to do quite a bit of research into this. But I think for listeners out there, if you could explain to me, like, I've never had a heart scan, I don't know what it is. What does Cleerly actually see that a normal test wouldn't pick up?
Yeah, so here's exactly what it entails. So number one, you would go in for what's called a coronary CT. So picture the machine that you're laying in, and it's about a 15-minute procedure, and you're going to get a coronary CT done of your heart, and we're going to upload those images remotely. We're going to upload the images from that CT into our cloud. We're going to run it through 10 machine learned algorithms, and then we're going to turn a report back around to your physician in about an hour and 20 minutes. And what it's going to look at, it's going to take a 360-degree view of your heart down to the vessels, and it's going to look for non-calcified plaque, calcified plaque, stenosis, meaning any narrowing of the vessels, and ischemia. So if you have a reduction in blood flow within your heart. And, oftentimes people will say, well, I've had a calcium score done and so I'm good. And it's like, it's not the calcified plaque that you have to worry about. It's the non-calcified plaque. So the non-calcified plaque in your heart vessels is what can rupture. And when that ruptures, that's what creates the blockage within your heart vessel and essentially creates a potential for a heart attack. So yeah, we are primarily looking for that non-calcified plaque, stenosis, and ischemia in your heart to then determine, okay, does your physician, is any treatment required whatsoever? And if it is it medication? Is it going to the cath lab to have a stent? Is it going to bypass surgery? Like, how severe is it? Because I can't tell you the number of times we've had patients that we have scanned had no symptoms whatsoever, and were walking around with a severe blockage within their heart artery, essentially, one bad day away from a massive heart attack. So it's, that's what we live for.
So it is, well, it's quite public knowledge. A lot of your work comes from massive data, right? Analyzing millions of images, tens of thousands of patients, and I could be asking a bad question here. What do you feel is more important, this massive data that you've got or the algorithm itself?
I mean, it's like, both of them go hand in hand. I can't sit there and say like one's more important than the other one
Yeah.
because, yeah, the algorithms are the foundation. But then as we're gathering more and more data, more and more images, that algorithm is constantly being improved, constantly being enhanced to be that much more effective, that much more precise, and that much more specific. So like with any AI tool, that's out there these days, like the more data that you can feed into that algorithm, the more precise that it's going to be.
And something I find interesting is, some of the hardest people in the world to sell to is cardiologists. It's a known fact. They're very tough guys to sell to. So how do you go about selling a peer-reviewed science to these guys? Is the bar higher or lower than when it was selling a device? And I guess that depends on business to business, but in a clearly specific case.
Yeah, it's well, number one, we're very fortunate that our CEO is a world-renowned cardiologist, right?
Yeah.
So Cleerly is built on data. Cleerly is built on science. I often say to people, like, look, I've worked with some great organizations, med device organizations in the past, where I worked for Guidon, and I worked for Boston Scientific, and I worked for Getinga, during that 12-year period. And I often say I have more clinical data here at Cleerly than I had at those organizations combined. It's just I've never had so much clinical data as an organization. And when you're selling to a cardiologist or you're selling to anyone, whether it's within a hospital or physician practice, I always say there are three stakeholders, and they might be the same person or they may not be, depending upon the facility that you're selling in at. But I said there's the clinical sale, there's the workflow and efficiency sale, and there's the ROI, the financial sale. And with cardiologists in particular, as we know, like, if you don't have the clinical data to be able to back up what you're stating to be factual, then you're wasting your time. And we're very fortunate with the amount of clinical the publications that we've had with Cleerly that show like this is the most effective technology out there on the market in comparison to any technology when it comes to the diagnosis of heart disease.
Let's strip it back. I want to talk to you about the playbook then, because you joined Cleerly pre-revenue, roughly 34 employees. What did that business look like then compared to where it is now?
Yeah, when we first started, it was interesting because when Jim Min first hired me, originally he thought that, hey, we're going to institute what you guys instituted at Livongo, and we're going to focus on employers first. And quickly we determined like that wasn't the right pathway. for us for a multitude of reasons. The other thing, though, that we had to quickly figure out is that there was no coverage and reimbursement whatsoever on Cleerly. So how are we going to generate revenue from this technology? And so we made the decision that we were going to focus on that concierge market first. It fits very, very well into Cleerly's mission. The concierge market is heavily about prevention. How do they catch disease early, regardless of what it is, of whether it's heart disease, breast cancer, diabetes, so on and so forth. And so we really went after that concierge market, hook, line, and sinker, first and foremost. And that's where we got our start. And at the same time, we built a great market access team that would then start doing the work necessary to help Cleerly get category 3 codes and ultimately category 1 codes. So get coverage and reimbursement from Medicare, get coverage and reimbursement from the commercial payers. But it took, a full 4.5, almost 5 years to be able to accomplish that. So it was an evolution, starting out within the concierge. And concierge is still a big section of our market. It's still a big section of our revenue. But now that we have codes, coverage, and reimbursement for symptomatic patients, we have now, very much migrated into the traditional hospital space, traditional cardiology space, imaging center space, to where now physicians, for those patients that are symptomatic, they can order it Cleerly and know that, the vast majority of time it's going to get reimbursed.
I want to take a minute to say thank you to our sponsors, TTP. TTP is a leader in complex medical device development. With deep scientific and engineering expertise, they help medtech teams crack tough development challenges and make the right calls early, reducing rework, delays, and uncertainty later on. Whether you're navigating uncharted technical territory or racing towards market, TTP brings clarity and real-world judgment to the decisions that shape performance, usability, and manufacturability. By retiring risk early and grounding innovation in real-world constraints, they help you move forward with speed and confidence. To find out more, check out the show notes.
And I know it's the $1 million question, right? But what do you think has been the most critical part of building this commercial engine to get this right consistently?
Yeah, I mean, it comes back to the people. It comes back to the more so than anything else. I always say, like, look, you can have the best laid plans in the world, but if you're not putting the right people on the team and then the right positions, like, you're gonna fail. And I think that's more important than anything else. I've had the very, very good fortune to be not only part of a great team here, part of a great leadership team, but also to help build out an amazing commercial team. People are drawn to Cleerly because of the mission. And, but I always tell them as we're interviewing them, I'm like, look, I'm going to tell you straight, like, this job is freaking hard. Like, it's hard. Like, anytime you're trying to change physician behavior and you have a new technology, it's not something that is top of mind for patients or physicians. Like, it's like pushing a boulder up a hill. Even though it makes perfect sense to you, it's friggin' hard. And so, but what I tell them is that, look, you're going to have days where you think to yourself, because the job's so damn hard, that, man, what the hell was I thinking, coming here? But you're never going to have a day where you say to yourself, is what I'm doing meaningful? And that all goes back to, we've heard it before, whether it was the Simon Sinek book of Start With Why. Like, what is somebody's why for joining Cleerly? And, when I hear people that I'm interviewing talk about, like, well, my dad died of heart disease, or my mom, passed away, or my brother, and, like, this is truly meaningful for me. Like, I love that, because I know that they're going to have days where they feel like they've been banging their head against the wall. And, like, that's the reminder of, okay, this is why I'm doing this. So to prevent somebody else's dad from dying of heart disease, or somebody else's mother. And that's ultimately what's going to carry that person through the tough times, having that grit mentality.
And how do you test for this then? Because your revenue numbers are very consistent, double-digit growth year on year, and it's in a market where consistency is not always easy to attain, right? So you've mentioned that it comes down to building that great commercial engine, great people. So what do you look for specifically when you're speaking with people that want to join the business?
Yeah, what I look for is I say like my hiring philosophy, I look for three things where I say it's skill, will, and fit. You
Hmm.
know, the skill is based upon what they've done in their career already. You know, how easy do I think the transition is going to be over to Cleerly? Have they been in cardiology or not? Have they been in med tech or not? Have they been in a digital software sale or not? Have they called on cardiologists? So that's all the piece of the skill side, right? Like how easy, is that transition? And then the will is ultimately what is their drive and motivation for wanting to do this. And I'll often say in an interview that, look, like we don't have 100% of the recipe figured out. And if that's what you're looking for, like you're going to be sorely disappointed. But we've probably got 65, 70% of it figured out. And if it excites you to come on board an organization and help us figure out the other 30%, 35%, great. But ultimately, like what is their drive? What is their motivation? You're trying to assess what is their level of grit and determination, going back to what I said before, because the job's hard. And then ultimately is that fit. The fit is the cultural fit. Okay. Clearly, again, very mission driven, but very collaborative. And even whether we were 30 employees or now almost 400 employees, it's like we encourage that collaboration amongst the organization, not just within commercial, but collaboration with finance, collaboration with HR, collaboration with product. Like I often say when I'm hiring somebody at Cleerly, it's like dropping a rock into a puddle, as opposed to hiring somebody at a large organization where it was like throwing a rock in the ocean. When somebody drops into Cleerly, the whole organization is still of the size where they feel the ripple effects of that hire. And so, you have to make certain that when you hire people, you're truly assessing like, hey, even aside from the skill and the will, am I going to enjoy working with this person? Are they going to enjoy working with us? Because life's just too short to like work with people that make you miserable, quite frankly.
And one thing I want to talk to you about with on that topic, a few areas of it really, you're in a fortunate position where your business can come from different areas. You mentioned there like cardiovascular, different areas of medtech. People often talk about the talent lock right now. The big companies locking people in, they get smaller territories, get paid quite heavily. How do you get creative with that? What kind of skill sets or even markets are you looking into right now where you're finding talent that can almost cross the bridge and fit really well into Cleerly?
Yeah, I mean, for us, we utilize a lot of AI tools now when it comes to assessing the marketplace. So, when building out that commercial engine, we did the segmentation to understand, like, hey, who are the right customers for Cleerly, and then it's a matter of digging deeper, like, where are the right geographies for us to have people, and whether that be on the number of cardiologists within an area, how many CCTAs are ordered in an area, what's the coverage and payer relationship within an area. And ultimately, we utilize these tools so that the reps and the managers don't have to figure that out. So now they can focus on truly what they're good at is hiring and selling, more so than anything else. So, I mean, this is one of the things that I encourage everybody when it comes to AI. We all hear these, great things and then horrible things, and learn it, learn to utilize these tools, because the people that don't learn how to utilize them are the ones that are putting themselves in danger of obsolescence. Don't be afraid of them. Try to understand where the tools can help you, and to where you can focus on the things that you're really good at more so than anything else. And I think that's the key. And so as we've hired, as we've expanded, and as we'll continue to expand, we very much take that data, that information into account to look at it market by market by market to be able to say, hey, where are the right areas for us to hire people? What are the right geographies? Do we need a hospital rep? Do we need a provider rep? Do we need a clinical account manager? Ultimately, what is that need? Because there is a very distinct playbook that we have in place from when we sell an account to how we manage that account to how we renew the contract for that account. It's a model that we have that once we bring people in and train them to that model, it makes their life easier rather than making it more difficult.
My other question, and I think this one is, it's going to tip either way with people's opinions. So you've mentioned there that you're at an incredible pivot point where people that join the business still have that ripple effect. So culture is massive for you guys. You're also at that point where revenue is really important. would you realistically turn away a big rainmaker, someone that's going to bring a lot of revenue, if they are going to dilute that culture that you're building?
Oh, I mean, let's put it this way. Like if somebody, if there was somebody that was just a big rainmaker, but they were going to create havoc in the organization, we wouldn't hire them. We just, it's culture is that important to us, because we've seen that situation, multiple times. Like, I compare it to, I use the analogy of a speedboat, coming by. It's like, you've got this rep or this manager who's excelled at everything, but when they come passing by, they create this massive wake, behind them.
Yeah.
And it just creates too much collateral damage, and so no, I mean, we really try to spend as much time with the person in the hiring process as we can to really, I think it goes both ways, to where number one, we want to learn as much as we can about them, but then we also want them to learn as much as they can about us. Like, am I truly someone that you would enjoy working with? Is this a company that you would enjoy working with? Because honestly, you're probably going to spend more time with us than you spend with your own family, a lot of the time. And you really got to enjoy what you're doing. Otherwise, like, you're going to be miserable.
Let's talk a little bit about, a lot about the commercial playbook you just mentioned there. So I don't know how much you can and can't tell. First question, actually, your commercial playbook now, does it look similar to the days when it was selling into cardiac surgery and intervention, or is it completely different now?
The similarity is what I would say, and I think this is true of any technology that can be utilized in the marketplace, is those three buckets that I mentioned. The
Yep.
three buckets of the clinical, the workflow and efficiency, and the financial/ROI. Like that, I developed that for my team when I was back at Guidant, back in 2005, and that doesn't change. So whether you're selling digital health or you're selling software, med tech, or you're selling a med device, like, even when a rep will say to me today, like, hey, I had a great meeting with so-and-so doctor, he or she wants to bring this into the hospital. I'm like, great. You had one, you covered one bucket. Now, what about the workflow and efficiency side? What about the radiology tech? What about, who's ordering the test? Who's processing the test? Now, what about the CFO in the hospital? Or what about the department head? What about the financial piece? That's all the same. Okay. Where I would say that it's different, and some of the tools that we have now to where we didn't have before, is that we can truly get a lot more granular in what is the, what I call the pipeline velocity. How long are things staying within a particular stage? Having dashboards now to where we can walk in and see that information rather than having to crunch that information, by hand. So that's where I'd say, like, the differences are how much more efficient that we can be. What doesn't change is ultimately, who are you talking to? What is that value prop, and why should they utilize this technology? And that all stays the same.
And what's one non-negotiable that stayed in your playbook throughout the whole of your career?
Yeah, the non-negotiable for me, anybody would tell you this who works at Cleerly, is integrity is the foundation of everything we do. I would much rather us lose and not make our numbers and do it with integrity, honesty, both internally and externally, than win. So I always say, like, we will do the right thing all the time, and the right thing for that physician, the right thing ultimately for the patient. Like, if there's ever a question, on whether it's the right thing or not, then we shouldn't be doing it. And so the foundation of any commercial team that I've had is like, guys, we're always going to do things the right way. We're going to treat each other with respect, and we're going to collaborate. But at the end of the day, like, no one is ever going to be able to look at Cleerly and say, man, that organization is either unethical or they're doing things a little bit shady. Like, absolutely not. So integrity is the foundation.
Perfect. We've talked a lot about success. We've talked a lot about what you've been building, the amazing company that you're working with currently. Throughout your career, there's got to have been some times when things got scary, right? What's the biggest thing that could keep you up at night in your career?
Yeah, I mean, I think the biggest thing, is always, particularly with, with a startup, the number one reason startups fail is they run out of money, right? And so then you have to ask yourself of, like, whether it was when I started at Cleerly or even when I started at Livongo, is like, hey, can we get the flywheel going here before we run out of money, and that's ultimately like what you're trying to do with any startup, so that you don't borrow your way into oblivion and dilute all of the shareholders. Is like you're constantly racing against time, because the money balance is going down, and ideally the revenue is going up. But at what point do those two things cross to where you're not so concerned about, hey, is this going to make it or is this not? There were definitely some touch and go times that Cleerly, where we were, as you're working through with Medicare, you're working through the commercial payers, and you're thinking to yourself like, hey, are we going to get coverage for this, or not? Is Medicare going to cover? Are they going to reimburse for this? And how long is it going to take? And also, what is the reimbursement amount that they're going to be able to offer for this? So there were definitely days early on where we couldn't even sell Cleerly in a hospital because we had what was called an NCCI edit in place, to where anytime a physician wrote an order for Cleerly, it would automatically be denied, and hence why we had to go in that concierge market place first. So I would say, like, yeah, those are times where it's touch and go, to where it's like, man, I know I believe in this, and I know the technology makes sense, but I often say, like, the market can stay irrational longer that you can stay solvent. And so, like, how long is the market going to stay irrational, prior to us achieving success?
And what are the early signs to overcome that? So there's got to be warning flags. There's got to be stuff that maybe comes up in those early days when you're having those conversations. What would you be looking out for if you were the CCO in a new business to avoid this?
Yeah, I mean, the things that you've got to look at, you've got to look at things like customer retention, not just customer retention, but when a customer buys from you, how often are they buying more from you? A lot of times newer organizations, they have what's called death by pilots, where, whether they're calling the hospitals or physician practices, they've got all these pilots going on, and yet nothing ever amounts from that. It doesn't go any deeper than that, or they're only getting 5% of the business of that client. Is like, when you start seeing the client retention, to where you're not churning clients, but also that instead of buying 10% from you, now they're buying 20%, they're buying 30%, like you're consistently seeing that go up, then, you can see, okay, the model is working here. The flywheel is in effect. We're seeing our sales cycle shorten now. We're seeing each stage of the selling cycle shorten now. We're seeing implementation take us a shorter amount of time. We're getting to revenue in a shorter period of time. All of those things are metrics that you're looking at as the CCO, of understanding, like, hey, is the model working or is it not working? And if it's not working, why is it not working? And what do we need to change?
It's interesting. And one of the common questions we get asked quite often than not is, when's the right time to hire a commercial team? When is the right time to hire a CCO? And I think people's answers are few and far between here. I think more often than not, people leave it much later than they need to. If you was working in a device company that was, looking to commercialize or get FDA clearance next year, do you think you're already too late now to start looking at a commercial team?
If you were getting FDA clearance next year, is it too late?
12 months away, yeah.
No, I don't think so, because again, it depends on the market that you're selling into. So, like, I'll give you an example, like, two different markets that we sell into. The sales cycle in a health system is very much different than the sales cycle in a concierge practice.
Yeah.
But, the opportunity for volume and revenue is much more significant in that hospital than maybe in that, one or two physician concierge practice, right? And so you have to be able to balance those. And in some respects of, like, look, if it's going to take us 12 to 18 months to close a hospital, what are we doing in the meantime to be able to generate revenue? If that's sort of our long tail of where we're trying to get to, in some respects, okay, that's great. We're going to have to make an investment in the people to be able to do that. But then how do we balance that out with areas that are shorter sales cycles to be able to generate revenue? Because you're ultimately going to take that revenue where you're generating it in the shorter side and be able to fund the opportunity or expansion in the longer side. And so that's why I say, like, it's very much like a barbell type approach, but it ultimately depends on what the market is that you're selling into, more so than anything else, whether it's physician practice or hospitals or both.
Okay. And what foundations are a must-have when it comes to that stage of a truly greenfield commercial operation?
Yeah, I mean the foundation is again, it's it's a matter of, do you have the right value prop in place from that clinical aspect, the workflow aspect, the ROI aspect. I mean, and I can tell you, like, depending upon who the stakeholder is in that account, like I'll give you for instance, like if I'm talking to a CFO, he or she's not going to care as much about the clinical side, because they're going to say, that's why I have physicians. Like, I rely on them to be able to tell me, is this the right thing for our patients? And if I'm talking to a cardiologist in that hospital about the ROI and the financial side, well, they're probably not going to care as much about that as the CFO. And so that's why I said, like, you've got to have a strong story to tell in each one of those, and it can't just be one, because gone are the days. This is one of the things, I sound like an old guy here from, guidance, but like, gone are the days of the cardiac surgeon just being able to pound their fist on the table and go, by God, I want this technology in this hospital and I'm going to have it. Those days are gone. And if you don't have the buy-in of the financial side, uh, more so than anything else these days, like, is this hospital or is this account actually going to have a positive return on this? Then, it can be the greatest clinical product in the world, and you're probably not going to gain traction, because the profit margin of hospitals now is somewhere between like 1 or 2%. It's like that of a grocery store. And so if the financial ROI isn't there, it's a showstopper on the clinical side.
That makes sense. Let's talk about the future then. So we've spoke a lot about building, and one thing that's probably important for you right now is to continue to do so. You've built some huge momentum. You've built a large team now. I think you're up to around 300 people now in the business. What's next for you guys?
Yeah, I mean, the next thing for us is just exactly what we're doing: executing and building. Continuing to double sales every year, continuing to expand, as appropriate. Um, there's obviously talk, out there of like, when will Cleerly go public, or will Cleerly get acquired? And I'll tell you the same thing I told Jim when he hired me. Is I said, Jim, our focus has to be build a great business. We build a great business, and then we'll have options of, whether that means Cleerly IPOs one day, or whether it's another organization that comes in and acquires Cleerly. But if we don't build a great business, none of those things matter. So we'll continue to focus on executing. We'll continue to expand the platform. You'll see more and more products from Cleerly, that where we will, I'd venture to say, within the next 18 to 24 months, we will look like a very different organization. But always, being focused on how do we best help physicians to treat their patients. And but yeah, the innovation that we will do over the course of the next couple of years, and the growth that you'll see, will make the last 5 years, look like child's play.
And I don't know if you've got the clinical data there or whatnot. Just how many patients are you treating per year at the moment, or looking to treat?
Yeah, when we look at our patients ourselves right now, I can tell you, here's what I can tell you. There are 1 million CCTAs a year that are being done just within the United States alone. The CCTA market is growing by over 30% a year. Even with the growth that Cleerly has achieved, we are just scratching the surface. Both in terms of revenue and volume, we've doubled it every year. Like, ultimately, where do we want to get to? We want every CCTA that's being done in the market to be done with a Cleerly. It should just be automatic. When a physician orders a coronary CT, it should just automatically be run with a Cleerly analysis, and that's what we're getting towards.
Fantastic. And you're FDA cleared right now. And I don't know if I'm going down the garden path here a little bit. Do you plan to go into Europe and the further markets?
We're actively looking at additional markets. I can tell you there's one already right now where we are, we'll soon be making an announcement as far as, the initial steps in going into that marketplace. The goal ultimately for Cleerly is for this technology to be available worldwide. We've always intended to start out within the United States because it's the biggest market, out there, and we still have a tremendous amount to do. But yeah, I mean, absolutely, we want to go into just about every market, out there in the world, because we want every patient to have access to this technology.
And that goes back to your mission, right? Your mission is a world without heart attacks, as you've said previously. So realistically, what has to change in how medicine works for that mission to actually become a reality?
Yeah, I mean, I'd say the things that have to change are a couple of things. I mean, honestly, like one of the biggest things that we see now is just a capacity issue. Like a lot of times that there will be markets where whether it's a hospital or whether it's an imaging center, they may be 6 weeks behind in being able to perform a coronary CT just because there are so many patients that want to get this done. And there aren't enough machines out there, or there aren't enough radiology techs out there. That's a limitation, within this market. And so, that's one of the biggest bottlenecks. Obviously, now that there's coverage and reimbursement for symptomatic patients, and the goal is to ultimately get coverage and reimbursement for asymptomatic patients. We are, on track to be able to do that. We believe that hopefully by 2029, which is only a couple of years away, as a result of a very large trial by the name of Transform that we're currently performing right now. But ultimately, the biggest bottleneck right now is capacity, and you can see the technology and how fast it's being adopted within the marketplace. So we are looking at ways like how do we open up these bottlenecks within different marketplaces for our customers, so that there aren't patients that are waiting 6 and 8 weeks to get a CT performed.
Perfect. Great answer. And is there any companies that you think are also going to be helping on this mission or working in a similar direction to speed things up and accelerate this world without heart attacks?
Yeah, I mean, I think this is, especially now with coverage and reimbursement, I think there will be multiple companies, within this space. There already are, right now. And that's a good thing. Like, I never view competition as a bad thing, because ultimately, if it truly is our mission, and it is to create a world without heart attacks, while we want all those patients to get it Cleerly done, because we know based upon the clinical data that it's the diagnostically most accurate technology available, you'll continue to see this market grow with more and more competitors, more and more technology, and ultimately that's the best thing for patients.
Great answer again. One thing I want to do before we sort of run the show to the end, to be quite honest, is I always like to leave listeners with a bit of value, and there's going to be tons of operators that are operating in similar spaces and even spaces where you've previously come from. What bits of advice would you give a CCO or an aspiring CCO that's wanting to build a commercial engine? What would be the biggest tips that you would give them from now?
Yeah, I mean, the first and foremost for me is like, any organization that you're looking at or any technology that you're looking at, like, make sure that it's something that you actually sincerely believe in, like at your core, right? It goes back to your why. Because again, like I can promise you, like just going out and putting together a team and selling a widget, like that newness wears off like really fast, and I don't care what they're paying you or any of that stuff. Like it wears off. And so you've got to truly believe ultimately in what you're doing. The other thing is like, it's truly understand like the model that you're trying to put into place and get the model down before you go out there and just hire 75 people and bleed all this money. There were learning lessons even for us, looking back in different marketplaces where we had to pivot, and we hired appropriately to be able to learn those lessons, to what works, what doesn't work. Like get the model down first and then scale the model. Don't try to do the reverse, and make sure it's a technology that truly solves a problem. In other words, like don't look for those, marketplaces where you think like, oh, it's a great marketplace, and now, here's a technology. Now I got to go find a problem to solve. Like, no, it goes back to, again, like ultimately, what is your reason for joining that? And is this truly something that you can see scaling to where, a very large segment of the population could benefit from this?
It's a great bit of advice. And on the same track, it's almost like a pitfall, really. If you was to do everything again at Cleerly, and you might have done it perfectly, who knows? But what do you think you would have done differently?
Yeah, it's a great question because I think about it a lot, actually, because you're going to make mistakes, and I always own up to those mistakes, and I say the same to our team. Like I encourage people to make mistakes because if you're not if you're not making mistakes, you're not trying hard enough. Like, and so we're going to make mistakes. And so looking back, over the time at Cleerly, like what would I've done differently? There are probably some different marketplaces that we went into to where I was like, we're probably too early, to go in that marketplace. And let's just go ahead and double down on some of the marketplaces that we're in, going back to, sort of taking my own advice of like, let's get the flywheel going first within this marketplace and demonstrate how that's repeatable before we go jumping into this marketplace. And, and that's one of the key pieces of advice. So whether you're calling on concierge or hospitals or imaging centers or physician practices, there were definitely areas, definitely even geographies where it said like, look, hindsight being 2020, like maybe there's a segment of the country it doesn't make sense for us to be in right now. Like, why do we feel a need just to add somebody there if we're going to burn through a lot of money? And so, going back, I would have stuck to that a little bit more. There were definitely pockets of the country where I said like, no, you know what, it's not the right time to hire somebody there. Let's stay in the areas that we're in for another year and prove it out.
And that's a great bit of final advice to end on today. And look, I want to wish you and the team all the best. I think you guys are building something absolutely epic out there. Again, I love going back to the whole mammogram of the heart. I think it's truly a great way of talking about the business and what you guys are trying to achieve. And I truly hope that you manage to finally hit that mission that you're looking for. So I can't thank you enough for your time, Jim. And it was a pleasure having you on the show.
Likewise, Jordan. Thanks so much for the time, and look forward to speaking with you again soon.
My pleasure. Take care. Thanks for listening to The Crux of Cardio. If there's one thing this space has taught me, both personally and professionally, it's that progress in cardiovascular care is never the result of one individual. It's built by ecosystems, by teams, by people willing to take the long bets on hard problems. At Crux, our mission is to support that ecosystem through talent, capital and community. The podcast is one small part of that effort, a place to share the real stories from people shaping the future of cardiovascular care. If you found value in today's conversation, I would love for you to follow the show and share it with someone building in this space. And if you're a founder, operator or investor working on something meaningful in the cardiovascular care space, we'd love to hear from you.